It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
All right, my friends, how many times have you heard someone say to you, boy, I'm depressed. Boy, I'm depressed. And then, you know, you were in a great mood, and then you talk to people, and all of a sudden you become depressed. Well, there are certain different kinds of depression. And we don't have a magic wand. As I've said many times, I wish I had that magic wand. But, you know, as we're here on this earth, we want to try to enjoy whatever time we have. So I thought we would discuss depression. And maybe after today's show, you'll feel a little better. And who better to have on the show who knows about depression is Ed Payne, who is a clinical social worker, only been doing it over 40 years. But you remember Ed was always on the show. And Ed, it's nice to see you.
Good to be here, and thank you for asking.
I'm glad you agreed to come on the show because depression is something that, can be brought on or whatever. So let's talk about very basic. Sure. What is depression?
Depression is a clinical state where there is, it's causing, we would say, clinically significant impairment, so that the individual is losing a quality of life, and it's persistent and it's durable over time. So it's not merely being sad because my pet died and things like that. That could lead to a depression, but it's a chronic state, goes on for days, weeks, months at a time, where there's a loss in the pleasures of life and several other major symptoms.
Okay, so how does one know, sometimes you hear, no, I'm depressed today, okay? Well, maybe that's because something went wrong and it's a minor depression. But sometimes, there are different kinds of depression.
Yes.
That, either it should be something that should be medicated.
In some cases.
Okay, so there are different forms, okay?
Yes.
What is the basic form of depression? What do you find throughout your years of experience? I know there's many forms,
yes,
but what is the most basic form that starts a person in depression?
Well, let's go with what you talked about first. Someone in the vernacular says, I'm really depressed about this. And it means that they're sad.
Yeah.
Right? But there are some symptoms that would say classify it as a clinical depression. And there's something we call the trilogy of depression, the three main features that one looks for. And first is a sleep disturbance. The person is unable to sleep. Their mind is not necessarily racing 1,000 times a minute. It's just, I'm lying there, I'm tired, I want to sleep, and I'm just staring at the ceiling. Or I fall asleep, I wake up, it's not like I'm wide awake, I want to sleep, and I can't. And this is more consistent than not over a period of days. The other one is a mood disturbance, similar to what we discussed, but it's persistent. There's a sadness, there's a loss of enjoyment in the things of life. It can be agitated or aggravated, snappy. Guys do agitated and annoyed better than we do many emotions. So when you're dealing with a man, one looks for an agitation. It might be, in fact, the sign of a depression. And then there's an appetite disturbance, where some people lose their appetite and just, I'm not hungry. Or I get comfort out of eating and I pack myself with foods for comfort, oftentimes simple carbohydrates that cause the brain to kick out a chemical named dopamine, which is one of the brain's feel-good chemicals, and so it gives them a temporary lift. So sleep, mood, and an appetite disturbance is what we call the trilogy of depression, and it's causing day-to-day problems.
So you have certain types of of depression. Okay, now sometimes we are our own worst enemies.
Many.
Where we say, oh, if I go there, I know I'm going to get depressed. Okay, or if this person calls, I know I'm going to get depressed. So I say, well, avoid these things. You know, whatever makes you depressed, avoid them. If you're surrounding yourself with people who are depressing, why do you want to be with them? And I'm not trying to be sarcastic, okay?
I understand.
Why do I want to be around Ed Pate if every time I'm with him, he's always downing, he's complaining, he's talking about people?
Yes.
So sometimes then we come home depressed,
Yes.
okay? What do you have to say to people like that?
Well, you're entering a really good subject with that, because a lot of depression is, in fact, caused how we're thinking about this. Okay? And so the essence of one type of therapy that is hugely effective in this and other areas is called cognitive behavioral therapy. Cognitive means, how am I understanding this? How am I thinking about this? And how does that affect my behavior? So if, for example, yours is one way of thinking, and frankly, a healthy way of thinking. Listen, I find these conversations bring me down. Nothing personal, but I prefer not to talk about these. If you persist, Sam, we're just not going to talk for a while. Now that's a direct way of doing it. There are others that would say, oh, if I tell him, he's going to be mad at me, or he won't like me anymore. Or, in a whole variety, depending on the relationship, a whole variety of other things. A kid growing up in a home who might be, say, in danger of being cracked or belittled, well, certainly they're going to get depressed, but it's not an equal power struggle. Very often adults, who then are now the adult children of the parents, still act as they were children, as my mother's going to be angry. So what you're raising here is, in the kind of therapy is, a question of, okay, so what is the worst thing that's going to happen to you if they get angry? And we help, in this particular type of therapy, usually effective, help the person consider other ways of thinking about the same thing and testing them out and seeing what the results are. Therapy doesn't happen in my counseling office. Awareness happens in my office. Therapy happens when you take something out and you do something with it.
We always say, I say, surround yourself with positive things. Okay, when you prepare yourself for disaster, disaster happens.
Yeah.
Okay, but when you start preparing yourself for success, being around people that are not necessarily a lot of money, but to have a good outlook in life. All right, I think that's very important, particularly for seniors. Well, everybody, but the teenagers is another category, where depression sets in.
And there's a lot of angst in teenagers, and one would expect that. In the elderly, yes, depression is the most common thing that we do, and it has to do with isolation and many other factors going into it, and also how I approached life coming into this.
All right, so we have a person who maybe lost a loved one.
Yes.
Okay, and it hurts. Okay, so you're sad, you're bereaving, and then all of a sudden you lose, you don't want to be around anybody, you become depressed, okay? What do you tell a person like that?
It's not so much telling. Therapy isn't so much telling as it is a way of helping the person bring things out of them and a variety of ways of thinking. Imagine a man or a woman married, you can see often looking at the obits, 40 or 50 years, and losing the person that they slept next to for all of that time, and the familiar noises around the house. Even one person told me this snoring today would be music. Yes. And so that is a deep loss and part of our identity. There's a him and a her, and then there's an us that's created in a marriage. More than either one, there's an us with its language, its sense of humor, its sexuality, its own history, and now that is gone. So the person has a huge adjustment, and if they say, I cannot go on with this, well, that's where they're at. And so a therapist's job in a case like that, and mine frequently, is gently validating this loss. Tell me more about them. Keep them alive. And then look at what are some of the things that are possible. How do you think it would honor her, him? What would they like you to do? You don't have to do it, just tell me. But once they're starting to tell me, those things were already inside. And so gradually the possibilities of other ways. Are they never not going to be sad? They're always going to be sad. But we find, in this way, we find a place for our grief, and we can continue. It doesn't go away, but we find a place for it, and we continue.
I guess probably when someone's going through this, immediately when a certain thing happens, a sudden thing happens, and there's a loss involved, you know, you get hit real hard, okay? And there's a lot of support that either family or friends that you need. Support groups, talking to people like you, okay, to make me feel, at least understand. Because we have to work our way through these things, okay? How important is that, Ed?
Critically important, very important. One of the things that happens in depression is we isolate. I'm a very, very dear friend of mine, Samantha Neiman, who started a suicide survivor support group for Hazleton, and does annual walks, awareness walks, and she's there with a support group. In what would be the most difficult thing, someone who has lost someone through suicide. And how do you even talk about that in the general public? Samantha is one of the area's treasures. There are many church-related support groups for people who have lost someone dear to them. And having someone in the same room, you don't have to translate for it. They understand from their own point of view. Validates your experience, because in depression we feel so alone. We believe there's no one to turn to and no one who could understand us. So yes, support groups, those who have lost a child, deeply traumatizing things. There's a group called Compassionate Friends, and these are all parents who have lost someone, for example, a SIDS child or a child through a medical illness, and there's that profound emptiness of a parent who couldn't protect their child. And also, what is a good thing now, there are a number of very good internet support groups where people of like experience can share and you connect with others.
Folks, I'm talking to Ed Payne, who is a clinical social worker. Numbers on the screen, Sam, if you put it on, if you want to talk to Ed about a few things. But sometimes we get to the point where I don't even want to live anymore. You get so depressed where you say, I don't even want to live anymore. And what's that first step? It's always that hard step to take. No one's going to help me. It's a lost cause. We come back, we'll talk a little bit more about that and see how we can maybe feel a little better about ourselves. Now, another thing, what about the weather? The gloomy weather, you know, and you know, what do we do inside the home, these things that make us feel good? We'll be back right after this. Welcome back to the Sam Lesante Show, folks. Want to tell you, Pottsville, we're on every day from 7 to 11 p.m. on the Pottsville area, channel 190, Comcast 190. Don't forget Wilkes-Barre, Kingston, and Mountaintop every Saturday and Sunday evening from 7 to 11 p.m. on channel 92. And of course, Lackawanna County, serving over 125,000 households on Comcast 190, Saturday and Sunday mornings from 8 to 11 a.m. and we're expanding those hours within probably in a couple months. My guest today is Ed Payne, who is a social clinical worker, and we're talking about depression. Now, there are different kinds of depression.
So meeting the threshold criteria, like I said, a depression that's causing some clinically significant impairment. When something is going on and it's in this very dark space for 5 consecutive days, and the most disruptive thing in a depression is the lack of sleep. Okay? Sleep disturbances, there's nothing. Bad night's sleep does not make worse. So if it's going on for 5 days, we say it's a clinical depression. Does that mean the person absolutely needs a counselor? No. Still though, needing people, needing to not be alone with themselves, and try to stay involved with life. We get it into about a 2-week consecutive period Now we're starting to call it a major clinical depression because the appetite's been way off and it represents a dramatic change. The sleep is disturbed, and I said now we're talking about some serious issues when the sleep is consistently determined. And you know, the mood continues to be this: I've lost all pleasure in things, I've lost interest in things. Now it's 2 solid weeks. So this, you know, then we're talking about major depression. It might be time to have someone like me, you know, get the opportunity to talk to the person. And by the way, the earlier, the better. The earlier, the better. There is another type of depression we call a bipolar depression. And this is a neurological condition. Okay? This is, to a certain extent, they all are, and we'll talk about family relations in terms of this in a moment. But a bipolar disorder is a neurological condition where the brain itself is not working quite right. And so the periods of depression can be, I have periods of up times where I'm feeling really good, and it's noticeable to someone else that that's a little odd, followed by periods of downtime where it's just very dark, and it might cycle, sometimes rapidly, sometimes slowly. And the euphoric periods can be anything up to looking, the person being awake for several days in a real, you know, buzz state. And the depressed part of it then can be so far down, it's almost lethal. And that's why I said depression has a high association with lethality, suicide. So that's a whole different thing. And then we have something called seasonal affective disorder, and we're starting to get to the end of the period where it exists, because it generally has its onset as the days start getting darker, and then and the darker they get and the less stimulation we have from the direct sunlight, it can get very bad. And we have a small portion of our optic nerve itself that runs into a little area of the brain called the pineal gland, which has a lot to do with our metabolism and our energy. And it begins to shut itself down a little bit. That's why you hear things like light therapy, artificial light therapy, that helps the person now experience more, you know, daylight. That is one of the best treatments of all without having to take medication for someone who suffers from that regularly.
Now, you said something about, you know, when does a person begin to understand, other than the daily thing, oh, I'm depressed today, we had this, we had that, excuse me, but that's a different kind of depression, okay?
Yes, right.
When you really start feeling that it's affecting your sleep, it starts affecting your appetite, and you don't want to be around people, okay? Sometimes, does depression itself, run in families?
Yes, yes, and this is important, and why clinicians take a real thorough family history to find out which side of the family, which blood members on both sides of the family. Oftentimes I'll do a family tree. Clinically we'll call that a genogram because it's not just the relationships, it is that, but now it's the whole bunch of psychological traits. And sometimes we trace this going on for generations. As a matter of fact, it was very helpful. It's very helpful in many cases. One particular case comes to mind, was a young woman who really didn't like this and didn't like the fact that she was on medications. But then doing her family tree, her father, who was still alive, was able to say, I suffer from this and I medicate from it. Can you tell me anything about your side? Well, Mom was hospitalized several times. And did you know your grandparents? I said, my grandmother was institutionalized. So now I see this coming down in multiple generations. It is far more born than made in that situation. And so now we're talking about medications as a normalizing agent, helping this brain now to have this, level the playing field, so this brain now has a chance.
Do medications work?
They do if they are prescribed correctly. It's the right medication for the right thing. Depression is not just one thing, as we discussed, and if you look at sophisticated brain scans of people, both who would be diagnosed with depression, you may find vastly different patterns of how the brain is using energy. So some doctors may, this is the one organ you can't see, and so to a certain extent, there's a lot of poke and hope.
Yeah.
If you don't know the symptoms thoroughly, you don't know the family history thoroughly, where at least you can get some Kentucky windage of about what class of medication am I looking for.
Okay, how important is it, you know, I said this many times, when I'm out having dinner or if I'm having lunch, I don't want to be aggravated. Okay, I mean, I want to have fun with, I want to have enjoyment. I want to, talk about different things.
For as far as your face is spread, how many meals do you have that people don't stop at your table?
Well, and I don't mind that at all.
know.
But the point is, I like to surround myself with people who are positive. It doesn't mean that they're going to tell me, Sam, I had an operation. I'm not talking. I'm talking about staying away from people who, number one, always have negative things to say about people, or they're always complaining about things, okay? They don't want to look at the better things in life. And look, we all have our bumps in the road, as Bishop Timley used to say. You hit a bump in the road sometimes. How important is that, or pick up the phone and talk to somebody, or watch a comedy, or do something like Norman Cousins did, okay? How important is that, Ed?
It is important, and it's very important. I need to get positive people in my life, people with energy and the like. But understand that it is not always that simple. If, for example, I'm in a family where there is a lot of depression. Let's go back to even earlier than let's talk about being born into a family where it might be chaotic or abusive, or there is active alcoholism, or there's untreated mental health. The child thinks that's normal. It's the only thing they can think. And their brain quite literally rewires itself to deal with that as normal. Now that wiring is already there, it's established. They're not going to make it go away. You can alter new things into it. But they have no choice about where to live and what they come home to. And if they finally, around age 6, 7, we call that a stage of industry versus inferiority. I'm out of the house and I'm connecting myself with other people in grade school. I see other families that are not like that, and now I'm confused. Yeah. Okay? And so these children growing up like this, wired to deal with stress all the time, are very often depressed. Okay? And if the abuse is profound, bipolar, because it will rewire the person for that. And many people I deal with bipolar were sexually abused, and badly so, if there can be any degree of that, as children. And so then how they will, that's now a biological issue. So yes, I'd like to surround, if I've got to go to work, it's the only way I can support my family, and it's not a positive environment. Well, I've got to go there, but how am I thinking about it before I get? Am I saying, I can't stand this? In which case you can't. If you say, this is 8 hours of my day, I only do it for the paycheck, for my family, have a nice life, everybody, but I'm going home to something else. That's different.
Yeah.
Okay, that's different.
The key thing, though, is that there are solutions out there for, we don't have, like I said, we wish you had that magic wand, but there are solutions. The thing is to recognize it and to address it. Folks, I'm talking.
You can't treat a problem you do not know you
Exactly.
have.
I'm talking to Ed Payne, folks. His number is on the screen. Many of us suffer from some kind of depression. We don't want it to get really serious. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. The topic today is depression. Remember, ssptv.com. All of the shows are there, particularly this show we're doing with Ed Payne. Remember, if you don't have cable, YouTube, just YouTube us SSPTV and you watch all of our program. Ed, I'm really, I want to cover so much with you, and we have to bring you on again. During depression, sometimes people turn to alcohol and drugs. What happens there?
Okay, now when you see something like this, the therapist here looks to me that they're trying to do a good thing a bad way, and oftentimes the solution turns into a problem all by itself because some of these things are addictive. And so I need to determine what is your drinking for, what are the things that, at least what did they start to be? Let's see if we can put a lid and hold on this, and while we now get into the depression as well. Certainly alcoholism runs in families, and that's a whole other show. But yes, people oftentimes will self-medicate in an attempt to deal with their moods.
The thing here is, as people are watching this show, okay, we have to understand that when you begin to sense that you are really coming into a depression, and not, oh, I'm depressed today, and then next morning you're happy. Sometimes people wake up, they're in a good mood, and then they hear things, and all of a sudden they drop.
That's different.
Yeah. Right. There is light at the end of the tunnel here.
Yes.
Okay. What do you suggest the people out there who are viewing this show that have some kind of depressions, not to panic, I mean, but what do you suggest to them?
First, of course, is don't be alone with it. Talk to somebody. Okay, family physicians are very good. Clergy are very good. Close friends are good family members you can. So first of all, reach out. Second thing, understand that sometimes medication is at least temporarily necessary to get the person out so we have a chance at least as addressing it, because the depression itself shows itself in a bunch of metabolic physical ways. And so sometimes we have to put this up to the degree where we can level the playing field. And for some people, like I said, with the chronic depressions, it may be something that normalizes life for them. And within those medications, there are different categories of medications that treat the thing differently depending on how this depression is manifesting itself.
Here's a very quick, here's my problem. If you have depression, okay, and you go to a doctor or a family doctor, and they're going to try to do the best, certainly the doctor said, well, okay, Sam, I want you to take this, okay? Now, maybe that is good, and maybe it's bad. Maybe I should know what the real cause of this is, okay? And that's where you come into the picture.
Yeah, I work with a number of
social work.
I work with a number of physicians, and we've got a good cordial working relationship. And with that, I can determine about what's going on here. Now, many doctors, because doctors are trained in diseases, not medicines.
Right.
Okay, you want to know medicines, you talk to your pharmacist. And they're doing the best they can, but they don't necessarily understand the different types of medications, what they do, and that to which they should be applied. So, you know, a character like me, a good, solid mental health professional, certainly there are psychiatrists who specialize in this area, but it's very important in terms of buyer beware. Make sure the psychiatrist is listening to you, is treating you with respect, cordial, and they are really listening, because it's very rare to find two psychiatrists agree on the same person with the same diagnosis and hence the same medication, and that can be a disaster.
Folks, I'm talking to Ed Payne. He is a clinical social worker, been doing it for 40 years. Hopefully, I have to bring him back to expand on different things so you can get a better idea. If you're depressed, there's things are happening, you lost a loved one or whatever, believe me, it's a difficult task. But try to do something to make yourself feel better. There's so many ways that you can make yourself better. I'm hoping after today's show, you do something positive, maybe give Ed a call, discuss some things, talk to your clergy or whatever, but make a move to get better. We only stay around here a little time. Ed, thanks for coming on the show.
Thank you so very much.
It's always a pleasure seeing you. Folks, we'll see you next time.